Hello, yeah, my name is Dr. Seth Crapp. I'm a radiologist, but I'm also co-founder, president, and chief medical officer of a health tech startup called Tellit. And we're debuting it here, officially launching at the NMA, and our official launch date was August 11th.
Okay. Can you tell us a little bit about Tellit? What is it? What does it do?
Sure, so Tellit is actually the brainchild of myself and my partner, Alan Bottorff. He's the CEO of the company. Initially started as a concept around telemedicine, which is a business we're very interested in getting into. Myself being a physician and radiologist, we're kind of pioneers in the telemedicine space. We use something called teleradiology, which is basically reading remotely for hospitals and imaging centers and facilities. So Tellit came about when we started thinking about inefficiencies in healthcare and what could we do to decrease inefficiency, improve relationships with patients and providers. And we came up with this concept of utilizing blockchain technology. So Tellit is a blockchain-based health ecosystem, really for housing, transmitting, and sharing patient records. And also there's a payment system that's also built into it on top of the blockchain, which is the underlying technology, such as Bitcoin and cryptocurrency. Those kinds of things are built on blockchain. So that's a component of it as well. And there's also a telemedicine piece. So it's an entire ecosystem all built around blockchain.
Okay. So why should patients care?
Okay.
How does it affect the patient? And two, how can they find it?
Okay. So just recently, this was in the news this week, there was a major breach of a major laboratory company. And breaches like this happen pretty frequently, all the time. So once these records are breached, if my record's breached and I'm utilizing a lab company, data shows that each of these breaches can cost up to $300 to $400 per breach. So if you think millions of people just got their records breached, you're talking a lot of money. So that's one thing. That affects cost overall. So that's costing you. Someone's going to have to pay for that. The other thing is the inefficiencies in healthcare. So patient records are scattered all over the place. So it's a fragmented system. So for instance, a patient, if they choose to come to me for a study, if I'm a radiologist and doing that, they can actually not immediately hand me over their records. I can't see their history. I have to request it from another place, another institution. Maybe they went somewhere else. Maybe they live in a different city. Maybe they just recently moved. That's very inefficient. So it affects patient care. So they're actually getting care that's suboptimal. So something like this can actually unify all of that data, put it all on one source, which is the blockchain, which is nothing more than it's a digital ledger. Let's call it that. And the blocks in a blockchain are nothing more than sets of data that are put together in a group, and they call it a block, but it's a grouping of data, and that's set aside and that's locked with some form of code, and it's a secured code. Then you have another group of data, that's another block. So think of it like blocks of like Lego blocks. So each block, the Lego block would represent a block of data. It creates a chain, and that is a permanent record. It can't be changed. They use the term immutable. It can't be altered, and it's there permanently. So in a situation like that, it's also highly secure because each block is cryptographically locked or by code. So in essence, you have blocks of data all secure, and it's been said that it would take all the computing power in the world and probably 50 million years to break one of these blockchains, unless it's breached because of some hole in the system, but that never really happens when it's done properly.
Okay. So where can we access, as a patient,
Yes.
where can we access this technology, like, right now?
Okay, so Tellit is launching. We've launched. We have a website. It's called www.telledactyl.com. That's TELEDACTYL.com. And blockchain is under development. The program has had it. It's being sorted out in terms of all the specifics in our protocols, and it'll be available there on the website as soon as the user interface in our initial prototypes are there. But a usable prototype that they can actually feel and see, that's going to be available last quarter of the year.
Okay. So you spoke earlier about how can this change the cost of healthcare? How does this technology change the cost of healthcare? Because everybody's concerned about how much healthcare costs are skyrocketing, and, so how can this change that?
Okay, so something like this addresses, the primary thing it addresses is inefficiencies, right? So average, we can say there's probably $500 million in waste, or you can call it costs that are non-direct healthcare costs in our system, in the United States. So if you can at least decrease some of that inefficiency in the system, you're saving hundreds of millions of dollars potentially. So that drives down costs. So where you're paying a certain amount for a certain procedure or something else, that will bring that down. Now, the other thing it addresses is eliminating the need for a lot of third parties that sort of operate between a patient and a physician, so a provider. So by removing all of those blocks and all of that red tape, that also decreases costs. So, I mean, we're not here to replace insurance. We realize that there's a place for insurance. There's a place for government programs and those types of things. Catastrophic insurance, per se. If someone has a major medical problem, unexpected, and some catastrophe, that may be needed. But this is more around preventative care, around services that there's a lot of physicians that have gone to taking cash for services or fee for service, direct payments. And this is something that's perfect for that. It's right up their alley because they can have a direct payment from a patient directly to them. Now, on the other side of it, you think about, well, what about physicians? Like, how does that help me out? So in terms of physicians, a lot of times when you perform a service as a physician, you have to bill for it. So you're not necessarily billing a patient, you're sending it to an insurance company. So in that whole cycle, it's a long revenue cycle. So you have to bill the insurance company. Well, first of all, let's start from the beginning. You have to say, okay, I want to do this procedure for this patient. You have to get that approved by the insurance company. And then secondarily, you do the procedure, the service. Then that has to be billed to the insurance company again that approved it. They have to approve for payment, send payment. And often there may be billing companies involved that the doctor may hire, all kinds of people in the middle of that. This eliminates all of that. So it says, okay, if you come to me for a service, it's maybe $50. You can pay me directly, no strings attached, no hassles. I receive the payment directly as opposed to waiting around for 3 months, 90 days, sometimes even 6 months. And just recently, I mean, the current administration has said that they're going to stop doing certain payments to providers and insurance companies, and those payments may not come until 2019. So just imagine if I'm a doctor and I have an office and I'm relying on this revenue to come in. How can I operate a practice when payments aren't coming in for 6 months or 7 months? So this is just a way to kind of eliminate a lot of that. We may not eliminate all of it, but we can tackle just even small percentages of the inefficiencies. We can save millions and millions and millions of dollars. And that's what our mission is.
Okay. So essentially you're saying, so faster payment, more direct payment, eliminating the middleman, get things done more efficiently.
Precisely.
Okay.
Precisely.
Final question for you. I
Yes.
have to ask, so how did you get into medicine in the first place? Was there a defining moment where you thought, man, this is what I want to do?
Well, I can tell you from a very young age, I was always interested in science.
Okay.
So I mean, I was a kid, at 5, 6 years old, I would go try to find like one of my aunt's white coats. She was like a nurse and that kind of a thing, and just put it on and pretend I'm in the lab and mixing stuff up in my mom's kitchen, getting in trouble, by the way. But always interested in science, always interested in how things work, the body, just in environment, nature. So that kind of drew me into science, and then from there, just meeting, several people along my path growing up and in school, in high school. One of my mentors, a guy by the name of Dr. Nelson Adams, he's the past president of this organization, the National Medical Association, a very key mentor to me growing up, and developed my interest in becoming a physician. Probably around as a teenager, about 13 years old or so. And it just kind of went from there and ended up going to Florida International University and subsequently attending Meharry Medical College, which I'm a proud alumnus of. and just went on from there to pursue a career in radiology.
Awesome, awesome. So you heard it here first about Tellit coming soon to everywhere.
Absolutely.
Everywhere near you. Thank you, Doctor.
Thank you so much for the opportunity.